Hi everyone, I'm Jaya Vishwanathan and you've found the No Brainer podcast where I discuss all things neuroscience in delightful conversations with various experts. I hope you enjoy today's episode.
Hello, everyone. I am so excited to invite you into our latest episode of the No Brainer podcast. I'm very, very happy to introduce you today to a dear friend of mine, Dr. Whitney McFadden. We have had many conversations about neuroscience, our body, behavior, and health, even across the Thanksgiving table, dinner tables, and I've enjoyed every single one of my conversations with Whitney. And so I'm sure that you all tuning in will also enjoy all the insights that she has to offer. So without further ado, let me introduce you to Dr. Whitney McFadden, who started her career with deep admiration for her father, who was also a passionate psychiatrist, who instilled in her a love for biology and the joy of a fulfilling career. So she delved into molecular and cell biology with an emphasis on neurobiology at the University of California, Berkeley, and later pursued medical education to University of California, San Diego. She was driven by research passion, and she completed psychiatry residency at the Mount Sinai Hospital in New York City, alongside a deep study of neuroscience, studying brain cells and schizophrenia genetics. After graduating, she worked at Harvard Medical School in the Department of Genetics with Dr. George Church, studying genetics and schizophrenia in brain organoids. Intrigued by women's psychiatry, she began to explore reproductive mental health, hormone health, and treatments in the nervous system. She immersed herself in these fields not only for her personal healing, but also to make a profound impact on those around her. Her sister created her own business and inspired her to then create her own medical practice that included innovations in mental health. After seeing patients transform their own lives with these innovations, she saw a huge opportunity to share this with women who are committed to living their life healthy, powerfully, and passionately. So Whitney, I have so many questions for you, and I'm so excited for you to be sharing, what you do and how you got here with our audience. So I wanted to start with, you are a pioneer in focusing on the whole body to address trauma and have developed a unique treatment focus. But before we get into the science and the nitty-gritty of it all, can you tell us a little bit about your journey and what you enjoy your work, as well as some of the research and clinical questions that you now work on?
Yeah, so thank you so much for having me on this podcast, and Jai, I'm really grateful for this conversation and to bring neuroscience and medicine and health to people at all ages and all places in their life, and to be able to really use it for their health and to implement so that they can see differences in their lives and think about the coolness of everything. Because that, I think, is like the main thing. My dad would teach me how cool this is and how cool is the brain, and let's talk about the parts of the reward pathways and all the circuits. And I just was like, wow, this is so cool. So I started really with his passion and his teaching, him teaching me and my sister, like, whoa, the brain is so cool. And I always thought medicine was an ambitious goal, so it was very appealing to go into medicine, but also that it was so valuable. Like, I thought, oh, what a gift to be able to learn all these things, and to learn all these things that are constantly changing. And like, as we learn more and more about our health and how our body works. So I just felt like it was always going to be, more to learn. And what I found is that over the course of my time, I studied molecular neurobiology. So I was really focused on the individual cells and what's happening in the cells, and then how are they all connected to each other in neuroanatomy. And I had an incredible professor at UC Berkeley who just like really felt the art of neuroanatomy and really taught me in an artistic way about how the mind works. And what I got from that, because I would pull an all-nighter before that test, and I was just like, trying to stuff as much as I could in my brain. And I really learned like the beauty of the three-dimensional structures in our bodies and what they look like and what the orchestra is of all these neurons firing in different ways in different places for different functions, and how they kind of go at the same time or at different times and in a sequence. And I was like, whoa, this is a dance. So it was really beautiful to just have that experience and have really great teachers along the way. I had a
Yeah.
great neurochemistry professor who pulled out all the opium pipes and showed us how like morphine affects the body. And we were like, did you use any of these pipes, mister? But he really gave us this like curiosity for what's happening at the cell level. How are receptors working in the brain? You know, like what are the communication messengers that go from one neuron to the next, and how do they work? It was so fun.
Yeah.
And then he would also talk about certain like certain drugs and how they would affect the brain, and certain drugs you take and you're not there, you know, or you take some drugs and you're in a hallucination. And, you know, so we got to
Yeah.
see like these different layers of consciousness, which was fascinating. Oh my gosh.
Mm-hmm.
It's like life can be different if you've got different substances in your body. That really kicked me off into wanting to understand schizophrenia. I have it in my family. My mom's side, my grandmother was diagnosed with schizophrenia. My dad's side, my uncle was diagnosed. So here I was in my early 20s looking around being like, am I going to get it? Like, when am I
Right.
going to get it? Just being afraid, you know, like, oh, this is
Yeah.
genetic. Oh, I have a high risk. What are the genetics? What's going on? And fascinated with it because it was a model where people have different consciousness of the world. They feel and see the world differently than others when they have that kind of break and when they have the symptoms. So it's like, what is consciousness? Let's learn. So I dove into schizophrenia genetics and the
Mm.
molecular biology underneath it, and I tried to learn as much as I could. And I went and worked with Joel Kleinman at the NIH and now the Lieber Institute, and I really wanted to like learn what was happening in the brain. And as I
Mm-hmm.
dove deeper and deeper into the research, I was like, oh, shoot, we don't know what's happening. I mean,
Yep.
there's a lot of information that we have these clues, right? It's a complex disease. There are like over 250 different loci in the genome, these places that are involved with this disease. So it's complex. And
Mm-hmm.
we do know there's an immune part to it, which is kind of cool. And we know what parts of the brain are involved, but putting it all together is still a mystery, which is exciting.
Mm-hmm.
Um, and and then I did research. I always done research because I was inspired by my mom. You know, she's an astronomer and she's a researcher, and she's always talking about the curiosity underneath everything. And it's good to be curious and wonder. So I would always be really curious and have these questions that I wanted to answer. And I started working in George Church's lab at Harvard, studying cerebral organoids. So we tried to take these cells from humans, make them into the brain, and then see how they formed into like these early stage kind of like globs of cells. And that was really exciting and fun. But I quickly realized that I was not somebody who's going to be pipetting for hours a day in a windowless room, that I
Uh-huh.
actually wasn't going to thrive just in the mechanics of it. And
Yeah.
that wasn't my magic spot. So I left and did clinical work and started working with people and realized that medicine and science can really inform care. And I also get to play in the art of medicine and really
Mm-hmm.
learn about what motivates an individual and what are the things that are unique to them that you can't study in science and that you can't find a study to support. And so I got to see what's evidence-based medicine and how can I marry
Mm-hmm.
that with like the art of working with an individual person. And that was really
Mm.
fun to play in that. And as I graduated psychiatry residency and continued to learn neuroscience, like clinically relevant neuroscience. It was really fun to bring in, like, what did we learn in the C. elegans worm? You know, the worm that we study, which has like 312 neurons, and we can
Yeah.
figure out how each neuron works. And what do we learn that we can apply to a person? And
Yeah.
how can I communicate that to a patient where they can use that information to say, oh, I'm not going to go. I'm moving away from that toxic thing like a little worm, and I'm moving towards the food. Like
Yeah.
these
Yeah.
basic principles that can really guide, like simplify our life and help us understand ourselves. And then I took on a lot of knowledge around hormones because I was having hormone issues, and I was like, I need to learn about this. And then I realized the world
I
of
see.
hormones was so essential for being a woman and a
Mm.
man, that we were in a world that we had all of these things really getting in the way of how our hormones cycle naturally. And I was like, ooh, we got work to do. So almost
Yeah.
every patient I talk to has hormone issues. So it's really important for me. I was like, oh, this is a really big place to be educated on. And it was going to
Yeah.
require a lot more education. And then
Yeah.
somatic therapy too, which is what I call like the nervous system pruning and retuning. So it's how we
Okay.
get to really honor our life experiences and then make
Yeah.
adjustments in our neurons and the connectivity to allow for us to have safety, guidance, to get our needs met and to live without trauma responses. So I can share more
Okay.
about that later. But it's been fun to keep learning and bringing all this, the neuroscience, into like having people feel better.
Yeah. Wow. So already you've touched on so many things that I'm passionate about too. And I can, this is why I love chatting with you anyway, like even outside of the context of this podcast. And I kind of want to highlight a couple of things that maybe we can explore a little further. So one of them, I really liked what you talked about as being the art of medicine as well. As an artist myself, I also really appreciate that. I think a lot of people tend to put scientific and logical thinking in a separate kind of box from this more intuitive, artistic, creative process. But as someone who does both, I wonder if you can expand a little bit more about what you mean by the art of medicine, because I love that concept, and I wish that there are actually physicians tuning in as well who also try to like kind of take that kind of view into their own practice as well.
Yeah. So one example is that cognitive behavioral therapy is a
Mhm.
therapy that has a lot of structure and has a lot of rules in it, and it has a very distinct way of operating. And in order to study it scientifically, you have to have consistency across all of that. So
Yeah.
when we say CBT is the thing, then most patients are getting a very similar structured approach, and that can be really effective. And a lot of patients have thrived getting, you know, treating themselves from depression, anxiety, agoraphobia, which is when you're like outside and you're worried about crowds. And so there are all these places to kind of use a structured, standardized method. And same with medication, like
Mhm.
the medications have to work on a significant number of people, and have to have benefit at a certain threshold for them to be
Mhm.
considered effective and then to be put into our pipelines. And there are people who don't benefit from it and have different side effects, and that there are people who use them and it's amazing and life-changing. And then there are people who
Yeah.
they actually need something else that hasn't been studied,
Yeah.
and so this is some of the place for the art. But whenever I do medicine, like I always think this is a tool to help people get to a
Mhm.
spot that can be better. And
Yeah.
we get to discover what's the underlying stuff, right? Because the underlying thing is not that there's a serotonin imbalance. The underlying thing is that there's something causing that serotonin imbalance, whether it's a
Mhm.
combination of genetics, lifestyle, environment, people, influences, internal concepts of self. Um,
Yeah.
Medical, like sometimes electrolyte deficiencies, sometimes mineral deficiencies, sometimes thyroid issues that are secondary to lifestyle habits or
Mhm. Mhm.
exposures that we don't know about, right? So it's really important for me when I'm thinking about, what's happening with someone, that we can see these little points of imbalance. Oh, this hormone imbalance. Oh, this poor sleep. Oh, this anxiety or panic attacks, and then look at it holistically and see like, oh,
Yeah.
what are the pieces here that are playing out? And sometimes there's like a root cause for it that we can tap into, and sometimes there are like five of them,
Yeah.
and there's not like a
Yeah.
linear way that this is happening. It's like a combination of a lot of things. So medicine is very like diagnostic, like you have five possibilities and then you eliminate one and then you test and you eliminate another and then it's very linear. And I love the nonlinearity of looking at a patient holistically using more of like a
Yeah.
functional medicine approach, which is
Yeah.
seeing how all of these things interplay. And when I think about neuroanatomy and neuroscience, I'm like, this is the dance. We go back to the dance. And I think that's where the
Yeah.
art is. that dance
Yeah.
part, organic play, like, and also things can be happening, but we might not see them. So we have to know that there's unknown happening. And
Yeah.
I love in science, they do this all the time, surrogate variable analysis, but it's just basically saying, hey, there's something we don't know and we have to just say it's here, but we don't know what it is. But we're just gonna like put a little placeholder here.
Yeah.
And I love that because we have to know the unknown. We don't know what it
Mm-hmm.
is, but we know that it's there. And
Mm-hmm.
same with thinking holistically. We can tinker and change and adjust and see what works and doesn't work and make other adjustments down the road. And there's stuff we don't know yet that's going to get
Yeah.
revealed as we dive in. And then it's cool to see patterns in people, across different experiences where you get to see, oh, this could be happening. Oh, this could be happening. And you explore that to see
Yeah.
like we're all human and we all kind of have a similar human experience to some degree.
Yeah. Yeah, no, that's wonderful. And I can definitely relate because I've always, in electrophysiology, you see that a lot of the time, whatever you can explain, that's like a direct signal in response to whatever your like picture you're showing or sound you're playing or whatever is just designated as noise. But then, what is noise? And if you start asking scientists, what do you consider like noise in the brain? It's like random firing of neurons or activity patterns that are unexplained. That's exactly what you said. It's just the part that we can't explain yet, that
Mm-hmm.
we're putting aside for now because here's something that we can explain, but it doesn't mean that it's actually unnecessary or noise because, I think the way I think of the brain is that it's one of its biggest priorities in functioning is actually efficiency, like energy efficiency. So it's not going to be randomly firing unless there's a purpose to it. And as you go back to the dance analogy, which I love, by the way, it's the same idea. Like you're not going to start flailing around your arms when you're dancing unless there's a point to that movement, either in time to the music or something you're trying to convey in that dance. So I really like your approach, Whitney, and thanks for sharing that with us. So, you mentioned earlier about hormones and cycles. So I want to take a step back towards that because I think a lot of our listeners and all of us really have an interest in how, we might even notice in ourselves sometimes our mood varies through the day. So the cycles can be diurnal, they can be hormonal through the menstrual or male hormonal cycle. It can be annual with the season. And so since you're, to work our sleep, as you mentioned earlier, so
Mm-hmm.
you're trying to understand these cycles that govern our body and then how they intersect with our physical and emotional health, as I understand. What are some of your key takeaways about how these underlying cycles are actually influencing our emotions and kind of aligned to that, women's health issues especially have been notoriously understudied in biology and in neuroscience and all of the sciences really. So can you tell us a little bit more about also the gender differences and like the big differences that you're seeing in male patients and male mental health issues versus female patients and female mental health issues?
Yeah, I see. Hormones are so important. I always say sometimes like it's another vital sign, like
Yeah.
your period or your testosterone levels. It's another, you check your heart rate, you check your respiratory rate, but checking the hormones is really helpful because it tells you when something's off, something's not balanced. And so it's a good radar, you know.
Mhm.
And actually, usually when people balance those things, then the hormones go back into balance, right? So a lot of times we don't need to like supplement with hormones or we don't need to add more in. Obviously, there's certain exceptions that are very specific around
Right.
certain cancers, breast cancer,
Yeah.
testosterone, that testicular cancer, that kind of thing. But in terms of using it as a gauge for how things are going in the body, if I'm having symptoms that
Mhm.
are on these cycles that are not in balance, and the cycle is
Mm.
such a beautiful thing and complicated, because it's
Yeah.
always changing.
Yeah.
But if we're having these interruptions in these cycles, it's good for us to be like, oh, let me pay attention to that. Okay, my my circadian rhythm, my daily cycle, my sleep-wake cycle isn't what it normally is. What information is coming in? I always think of the body as like the neurons are firing and giving us information all the time, whether it's feeling good or feeling bad or feeling neutral or anything on that spectrum. So we get to look at anxiety and depression and fatigue, and we get to look at joy and anger and happiness as like, oh, this is information for me. Like here I get to like take it in. And sometimes I have patients ask themselves, like, what is this situation saying to me? Like, if it could have words, what is this feeling in my stomach saying? What is this sensation? If it had words, what would it say? Because sometimes putting words to it allows us to like communicate with our bodies a little bit better to learn, oh, what is it actually telling me? Because I'll tell you, a lot of our culture teaches us to ignore these signals. We don't have a ton of communication with our bodies, like listening. We have a lot of, you should do this and you should do this. And our boss told us to do this. So we're going to do this. And our dad, our mom, our siblings, other people told us to do this. So we're going to do this. And not everybody, but a lot of times we absorb this from people growing up. And so then we're not really listening to our body. We're telling our body what to do. We're telling ourselves what to do. And the flip there that's really powerful is that I'm going to listen and trust that there's wisdom here, right? Because the way I'm wired, there's a lot of wisdom there that I have no clue about. If you think about how many neurons are in our nervous system and how they act and interact, like, okay, let me take a listen now, because there's stuff that my cerebral cortex, which is a very small portion of my whole body system, doesn't know about. And let me be open to what that signal is. So we kind of flip that switch and say, okay, what does my body need? And you know what? A lot of the times people need more rest.
Huh. That makes sense. Yeah.
And it depends. Obviously, if you're depressed, you can be sleeping a lot and you might not need more rest. But the actual depression is like, I actually need something else. Like I need a job that fulfills me. I see a lot of depression when the job tasks change and it isn't aligned with the skill set anymore. And then people are like, I don't know what to do because I can't get a new job, or I can't, feel like they can feel trapped. And then sometimes that depression can come in really as a signal that, hey, I need a change because I'm not getting the stimulation that my body needs to thrive. Or the anxiety, I'm not getting the actual support emotionally, physically, whatever type of support to really thrive here. Okay, this anxiety is telling me that. And it's really challenging for people to get their needs met, to listen to the anxiety and the depression and say, oh, my body's saying I need something, and to really go after it. Like that's a skill set that takes a lot of practice. So same with hormones. Our body is saying, if I'm cramping, if I'm PMSing, like I've got anger right before my period, if my breasts are tender, if I feel like shit, if I feel fatigued, some people, they'll just be flattened and just have to be in bed for a couple days, right? That's the body being very loud, saying, hey, pay attention. There is stuff that I need and you are ignoring it. And you know what? A lot of our culture doesn't teach it. Sometimes it doesn't get passed down in the maternal line for various reasons. And our culture and our work culture, much focus on school and education, there is not a strong teaching around what we need to support our hormone cycles. And then our body's going to be loud about it. If we ignore it or we don't know it, they're going to be like, true, hello, you're going to be a bitch today. Oops, I don't know if I can say that. You're going to be mean today.
Yeah, that's fine.
You're going to feel horrible today. Thank you. You're going to be horrible. And then we're like, okay, I'm paying attention. And the lineage of hormone cycles, I don't think is going to be as strong through the medical field. I've found the medical field will solve problems if there are issues, but they're not going to teach women how to support their bodies in their hormone health. That has to come from somewhere else because that takes time and education and leading and guiding. And so those things that support our hormone health have to come from nowadays coaches or people who are specialists that really take time and educate people over time with courses and stuff like that. So outside of medicine, I think we're really going to get a lot of the support around hormone health. And I have groups that I lead, and I have people join the groups, and we do education around hormones. And, nutrition is a huge part of it.
Yeah.
Nutrition. And I mean, one small thing is having as many herbs as possible in your diet, because herbs
Okay.
are so valuable. They're so anti-inflammatory. They help your liver function to metabolize hormones in a timely way. And they're
Right.
just so supportive. So again, like going back to nature, getting back to
Yeah.
the earth, getting on the rhythms of the earth, getting your feet in the grass, sleeping and waking from the sun as much as possible. Obviously, we have limitations on that.
Yeah.
And really eating stuff from the earth, stuff
Yeah.
that's whole foods, and not too much sugar,
Yeah.
alcohol, caffeine. And let me tell you, caffeine, whenever I start to work with patients, I ask them to get off caffeine. And a lot of them say, oh my
Okay.
gosh, I never knew that it could feel this good.
Huh.
And yeah,
Interesting. On
and
caffeine. Okay.
yeah, because caffeine will send adrenaline into the
Hmm.
system and cause a cortisol spike, and that can lower hormones. And actually, caffeine can change hormone levels depending on your ethnicity too. So it can
I
change,
see.
interestingly, there's like a heritage part to that. So,
Huh.
but the hormones themselves are affected by the adrenaline and cortisol. And
Hmm.
so I've had some women get off caffeine, she's like, oh my gosh, I'm not tired in the morning anymore because I'm sleeping better at night and
Right.
I wake up naturally and I'm
Yeah.
eating a full breakfast with protein
Right.
and healthy
Right.
fat. And before she was drinking coffee and not eating breakfast because it prevents appetite. Prevents people from having an
Suppressive.
appetite. So they'll eat
Yeah.
coffee and then like won't eat breakfast really. And then they're like gonna crash. They drink more coffee, and then all of a sudden their body's staying up
Yeah.
later. And so these
Yeah.
cycles happen, and our hormones are like, we don't love this. This isn't
Yeah.
okay.
Yeah. Yeah. Yeah.
So
Yeah.
that's one example, and there are many fine-tuning things to do to really support hormones.
Right. And I love that because what I'm hearing from you, maybe more subtly, is also approaching your own body from a non-judgmental space. I feel like that's another, like to
Yes.
listen to your body from and like respond to it, right? I think
Yeah.
a lot of us hold so much judgment towards ourselves. Like even if we're like waking up late for a meeting and then we're just kind of like mad at ourselves for I don't know, the half an hour or whatever that we're late for, whatever. And so I think what you're saying, which I really am like loving absolutely, is that, you have to listen to your body from a non-judgmental space. And one of the other things that I want to mention is what's always interested me is the fact that we have more of these connections going from our brainstem and midbrain, which are kind of the older parts of the brain, evolutionarily speaking, that are actually controlling all of these cycles and these hormones in our body, to our frontal lobe, than vice versa. So what you were saying was very, very much resonating with me about like your body will get loud and your brain is
Mhm.
wired for you to take notice when these basic needs are not being met, right? And so that's both anatomically and behaviorally. And so your message is very valuable, and thanks for sharing that.
Hey everyone, hope you enjoyed this episode of the No Brainer podcast and see you at the next one.